So metastatic pancreatic cancer is an absolutely dismal disease where even patients with on the most active contemporary regimens will have a median survival of less than a year. I've presented many times at ASCO, and it is not embarrassing at all to present a trial with superimposable survival curves. What is remarkable is to identify an active agent in this disease. So 4 to 7% of patients with pancreas cancer have a germline mutation in BRCA1 or 2. We know that Olaparib is a standard drug used in germline BRCA-mutated breast and ovarian cancers, and that a phase 2 trial in pancreatic cancer demonstrated activity in germline BRCA-mutated patients. And that led us to run the POLO trial, which was a trial in which patients received at least 4 months of platinum-based chemotherapy with no maximum limit to the duration, and they were then randomized to receive either Olaparib or placebo. What was really remarkable is that we saw a statistically significant and clinically meaningful improvement in progression-free survival in these germline BRCA-mutated patients. So patients on Olaparib had a progression-free survival of 7.4 months compared with 3.8 months on placebo. That's a hazard ratio of 0.53, or put another way, a 47% decrease in progression or death. From 6 months onwards, more than twice as many patients on Olaparib were progression-free. About a quarter of the patients on Olaparib had a partial or complete response to treatment. And what is truly remarkable is that in those patients with a response, the median duration of response was more than 2 years. For metastatic pancreas cancer, that is just amazing. Health-related quality of life was maintained over time. There was no difference in quality of life between arms, and the toxicities observed were exactly what we would expect with Olaparib, and they were fairly mild. The overall survival data is not yet mature. So in summary, this is the first study of a targeted agent in a biomarker-selected population of pancreatic cancer patients. It showed a clinically meaningful improvement in progression-free survival. And what this implies for treatment is that all patients with metastatic pancreatic cancer should be offered germline testing at diagnosis so that they might have the opportunity to receive this agent in the future.